Hello. Welcome another episode of On Puberty. In this episode we shall continue with uterine bleeding disorder. Are you ready to learn? Let's start. Examination and test. Your provider will rule out other possible causes of irregular bleeding. You will likely have a pelvic exam and Pap, HPV test. Other tests that may be done include complete blood count, CBC, blood clotting profile, liver function tests, LFT, fasting blood glucose hormone tests, for FSH, LH, male hormone, androgen, levels, prolactin, and progesterone, pregnancy test, thyroid function tests. Your provider may recommend the following: culture to look for infection, biopsy to check for precancer, cancer, or to help decide on hormone treatment, hysteroscopy, performed in your provider's office to look into the uterus through the vagina, ultrasound to look for problems in the uterus or pelvis. Treatment. 1. Treatment may include one or more of the following. 2. Low-dose birth control pills. 3. Hormone therapy. 4. High-dose estrogen therapy for women with very heavy bleeding. 5. Intrauterine device, IUD, that releases the hormone progestin. 6. Nonsteroidal anti-inflammatory drugs, NSAIDs, taken just before the period starts. 7. Surgery, if the cause of the bleeding is a polyp or fibroid. 8. Your provider may put you on iron supplements if you have anemia. 9. If you want to get pregnant, you may be given medicine to stimulate ovulation. 10. Women with severe symptoms that don't improve or who have a cancerous or precancerous diagnosis may require other procedures such as 11. Surgical procedure to destroy or remove the lining of the uterus. 12. Hysterectomy to remove the uterus. Amenorrhea. Amenorrhea is the absence of menstruation, often defined as missing one or more menstrual periods. There are two types. Primary amenorrhea refers to the absence of menstruation in someone who has not had a period by age 15. The most common causes of primary amenorrhea relate to hormone levels, although anatomical problems also can cause amenorrhea. Secondary amenorrhea refers to the absence of 3 or more periods in a row by someone who has had periods in the past. Pregnancy is the most common cause of secondary amenorrhea, although problems with hormones also can cause secondary amenorrhea. Treatment of amenorrhea depends on the underlying cause. Causes. The main causes of primary amenorrhea include family history, genetics, and lifestyle. Women with the following factors are more at risk. 1. A family history of amenorrhea or early menopause. 2. A genetic or chromosomal defect. 2. These can affect your ovary function and menstrual cycle. 2. Turner syndrome is one example. 3. Severely overweight or underweight. 4. An eating disorder. 5. An extreme exercise pattern. 6. A poor diet. 7. Stress. 8. Pregnancy, breastfeeding, and menopause can cause secondary amenorrhea. 8. Other possible causes include 9. Some birth controls, such as pills, injections, or intrauterine devices. 9. These can affect your menstrual cycle during and after use. 10. Some medicines for depression and blood. 11. Chemotherapy and radiation treatment. 12. Polycystic ovary syndrome, PCOS. 13. Fragile X syndrome, caused by the FMR1 gene, or Fragile X-associated primary ovarian insufficiency, FXPOI. 14. Problems with your thyroid or pituitary gland. 15. Hypothalamic disease. 16. Uterine scar tissue. Treatment options for amenorrhea vary based on the cause. You may need to make lifestyle changes, such as diet, activity, and stress. Certain hormonal medicines and birth control pills can help trigger a period. Others can help trigger ovulation, such as for PCOS. Hormone therapy may be used to balance out your hormones. Surgery is rare, but may be needed in some cases, such as 1. To correct genetic or chromosomal defects. 2. To remove a pituitary, brain tumor. 3. To remove uterine scar tissue. Dysmenorrhea. Dysmenorrhea is the medical term for painful menstrual periods which are caused by uterine contractions. There are two types of dysmenorrhea, primary and secondary. Primary dysmenorrhea is the name for common menstrual cramps that come back over and over again, recurrent, and aren't due to other diseases. Pain usually begins 1 or 2 days before you get your period or when bleeding actually starts. You may feel pain ranging from mild to severe in the lower abdomen, back or thighs. Pain can typically last 12 to 72 hours, and you might have other symptoms, such as nausea and vomiting, fatigue, and even diarrhea. Common menstrual cramps may become less painful as you get older and may stop entirely if you have a baby. If you have painful periods because of a disorder or an infection in your female reproductive organs, it is called secondary dysmenorrhea. Pain from secondary dysmenorrhea usually begins earlier in the menstrual cycle and lasts longer than common menstrual cramps. You usually don't have nausea, vomiting, fatigue or diarrhea. Causes menstrual cramps happen when a chemical called prostaglandin makes the uterus contract, tighten up. The uterus, the muscular organ where a fetus grows, contracts throughout your menstrual cycle. During menstruation, the uterus contracts more strongly. If the uterus contracts too strongly, it can press against nearby blood vessels, cutting off the supply of oxygen to muscle tissue. You feel pain when part of the muscle briefly loses its supply of oxygen. Menstrual pain from secondary dysmenorrhea is a result of problems with the reproductive organs. Conditions that can cause cramping include 1. Endometriosis, a condition in which the tissue lining the uterus, the endometrium, is found outside of the uterus. 1. Because these pieces of tissue bleed during your period, they can cause swelling, scarring and pain. 2. Adenomyosis, a condition where the lining of the uterus grows into the muscle of the uterus. 2. This condition can cause the uterus to get much bigger than it should be, along with abnormal bleeding and pain. 3. Pelvic inflammatory disease, PID, an infection caused by bacteria that starts in the uterus and can spread to other reproductive organs. 3. PID can cause pain in the stomach or pain during sex. 4. Cervical stenosis, narrowing of the cervix, or the opening to the uterus. 5. Fibroids, benign tumors, growths on the inside, outside or in the walls of the uterus.